Hello, good evening. Good evening, everyone. Good evening, good evening, good evening, good evening to Eyecare Online. Welcome to Eyecare Online. Sorry about that. Okay, I just trying to see how to create a room. Okay, let me see. What does this mean? Okay. All right. Okay. Okay. Hi. So, welcome to Eyecare Online episode 12. My name is Dr. Doris-Optometrist. Yes, and this is Eyecare, Eyecare Online. If you are joining us on Instagram, hey, welcome to the first Eyecare Online on Instagram. Yes, we decided to also come on Instagram because we get a couple of questions on Instagram, but it's been difficult trying to see how to schedule a different time for Instagram. So we decided to kind of do both of them. So right now I have two phones before me and each of them broadcasting differently. This is Facebook and this is Instagram, so bear with me if I'm trying to figure out. This is my first live on Instagram in a very long while. Actually the first time coming live on Instagram as a doctor, right? So please bear with me if there are little glitches here and there. So in order to make it easier for us to catch up on what's happening, I need to explain what Eyecare Online is all about. Eyecare Online is a program that we designed to create awareness on avoidable blindness. So people send in questions via DM, via comments, and then we now try as much as possible to answer them. Now we know that when it comes to health, most times you can't really explain everything you want to say via text message, so you have to actually talk about it in video, because sometimes personally for me, I articulate better when I'm talking than when I'm writing. So and sometimes you may have to show certain things, so the Eyecare Online becomes important that we come live to answer questions that people ask. Now, over the past couple of weeks, we have been we changed the trajectory of the program by not just answering questions, but to also discuss a particular condition or a disease. Last week we talked about glaucoma, right? So this week we'll be talking about cataract. All right, but before then, I will answer about 3 questions. I'll be answering 3 questions that I got from the comments that people sent in on Facebook, and then I'll also be announcing who the winner of our giveaway is. So kindly stay tuned. Oh, Manti, happy birthdays in arrears. Seriously, you know me now, right? You know now. So let me just do as if I did not see that message. When you're ready for the war, please come. Okay, we'll have that battle. But thank you. Thank you so much. Okay, so I have 3 questions here that I'm going to be addressing. Number 1 is from Mayene Daniel. Mayene said, I have scratches in my eye. What do I do? Okay, so first of all, when you have scratches in your eye, it's not good. It's definitely not good. You need to get yourself to the hospital. When you have a wound in your eye, just this evening, I had a lash fall into my eye this evening, so you can see that this eye kind of looked a bit red because I had to remove it. It was so uncomfortable, like I couldn't do anything. So even after removing it, I still feel as if there is sand in my eye. Now this is just someone that had a lash that has been removed. Now when you have a scratch in your eye, it can lead to so many things. Mismanagement of that can actually cause blindness, right? Because the scratch over time, if you leave it, can become opacified or can actually become ulcer, or kind of develop, like, okay, I'm going to use a mild word. Let's use a word. It can have wound. The wound can increase, right? And as the wound expands, it can cover the black part of your eye, and that means blindness, corneal problems, corneal abrasions, issues, and if it's still not managed, you can actually lose your cornea. And here in Nigeria, we are not quick to do cornea transplants. And even when you decide to do cornea transplant, it's so expensive. The last patient I sent for cornea transplant spent about 1.2 million, and that was 2015, 2016. So you can imagine how expensive it is to actually have corneal transplant. So if in the process of scratching your eye, because some of us experience itching that is so bad that you have them scratching. Couple of things can happen. In scratching, if you have nails, you can actually create a wound, cause a wound in your eye. That's number one. The number two, when you're scratching, you can pick up germs and infection, bacteria and all that, and put in your eye, which can also lead to problem. So when you are having itching, there is a post I'm going to I don't know whether I've done it or I'm yet to do it. It's kind of somewhere about home remedies for when you're having itching in the house and you don't have access to an eye drop or access to an eye clinic, right? There are certain things you can use, like a slice of cucumber that you put in the fridge, cold cucumber slice. Place it on your eye. It will relieve you of the itching, at least for the time being, until you can get to a clinic, right? So even cold tea bag, I prefer green tea bag, like green tea that you have finished drinking, you know, the bag, right? Put it in the freezer, leave it there. If you are having itching and you don't have access to medication or any clinic, place that green tea bag, the cold one on your eye. It will relieve you. Have instant relief. Anything but scratching, do not scratch your eye, because the complication that may come from there is a lot. All right, so that answers Mary Daniel's question. So if you have scratches in your eye, please go to the clinic. Let them give you some medication that will prevent it from getting worse. Effiong Joseph ACN said, I have pterygium. Is there any drug that can stop it? Okay, so last week I made a series, I did mini series post where I talked about what your eyes what your eyes says about your health, something like that. And I kind of talked about different eye problem, like pterygium. When you have this growth in your eye, I actually have one. So now that my eye is irritated, I think you can see this red movement, right? This red stuff here. Don't know if you can see it. I hope you can see it. Okay, some of us have that growth. I have the growth, right? And the truth that many of us have the growth, but you don't get to see it until you irritate your eye. So because I mentioned earlier that an eyelash entered into my eye and I was able to remove it, so in the process of removing that lash, I got my eye irritated. So this pterygium kind of, got inflamed, which is why you are seeing it now. So pterygium is more like a growth that you have on the white part of your eye that goes into the black part. Some of us have it in very small quantity like this, while some of us, their own is kind of very, very, very conspicuous, very, very visible. Now, when you have pterygium and it's beginning to get into the black part, there is no drug that can actually stop it. Now, what you can do is a minor surgery that we call excision, right? They do the excision. Now, an ophthalmologist does the excision for you, but it has to be an ophthalmologist that knows what he or she is doing, right? Because so that they can do it in such a way that it doesn't grow back. If you go to any doctor and they do it, the tendency for that to grow back within a short time is high, and that's usually the problem. So if pterygium excision is done and it's not well done, there are certain things that they need to do to prevent it from reoccurring. It will reoccur, and when it reoccurs faster than it was, right? So basically what we advise to patients to do is to try as much as possible to prevent the pterygium or to delay the progression of the pterygium. How do you do that? By wearing sunshade if you need to go out under the sun, because exposure to sun can actually progress the rate of growth, right? Then avoid touching your eye, because when you don't touch your eye, it doesn't get irritated. Avoid dust, protect your eyes against dust. Okay, so some of these things can help you delay the progression. But is there any particular drug that will eliminate the pterygium entirely? None for now. Okay, the best chance is excision. All right, so Mercy, and that's the third question and the last question for tonight before we move into cataract. Mercy said, I always have severe eye pain at night once I open my eyes. Okay, so in trying to understand this question, because I want to from what she just said, if you think about it just the way she wrote it, it's like, when you're sleeping at night and you just open your eye, you have eye pain. So I don't know whether it's early hours of the morning or in the night or something, but I know that there are certain times that when I spend a lot of time on my phone, on my gadget, and I go to bed, I have this, kind of dull pain in my eyes. But if I stay away from phone or gadgets for some time, the pain kind of, with time stops or reduces. Now, digital eye strain can manifest in different ways: eye irritation, dry eyes, eye pain, eye fatigue, and all that. And in this era that people are spending an average of 6 hours a day on their phone, it makes sense that you're going to be having certain challenges. Now, I'm not saying that this is why Mercy is having this pain, because the question is not really as clear as it should be. But if you are having severe pain and you're someone that is usually on phone or on gadget, then you have to cut down, limit your screen time. Limit your screen time to prevent digital eye strain. Right? Hi Chidima, thank you so much for joining. All right, so that's number one. Then number two is something you can also have go and have your eye examined to know why you're having this pain. If the pain just comes out of nowhere, you're not always on your phone, you're not it's not digital eye strain, right? Just go in, let them have your eyes checked. It could also be pressure related, right? So we have to look at your family history. Do you have history of eye problems, glaucoma, cataract, and all that? Then again, we have to look at the refractive errors. So many things can actually cause eye pain. It can be if you are short-sighted and you strain your eye all day. In the night, it makes sense that you have pain. If you have glaucoma and it's not and you've not been diagnosed of that, so you're not taking any medication, it can give you eye pain. If you are experiencing digital eye strain by a prolonged stay on your system, you can experience eye pain. So many things can actually, cause eye pain. And then, of course, if someone hits your eye, you have trauma, you can also experience eye pain. So the first thing is to understand why you are having the pain. All right, and that can only be done when you have gone for an eye examination. So those are the 3 questions I'm taking tonight, and let's move into the main topic. I'll announce who the winner is. All right, so the main topic for tonight is cataract, right? Last week when I asked, 2 weeks ago, yes, when I asked what topic do you want me to talk about, the number 1 topic was glaucoma, followed by cataract, then refractive error, myopia, and hyperopia. So I'm trying to pick it according to the number of requests that I got. So many people asked me what is cataract and what causes cataract and all that. So I'm going to try as much as possible to break it down in a very simple way that we can actually, that will be easier for us all to understand. So cataract is the clouding of the lens. Now, if you're looking at me right now, you can see the reflection of this light in the center of the black part of my eye. You can all see it, right? Now, let's assume that this light is not here. It means that you're going to see it's gonna be clear, like that black part is clear. It should be pure black, pitch black. Okay, not the big black one, but where this reflection of the ring light is supposed to be pitch black. Now, in a situation that pitch black actually means that the lens is clear. Now, in a situation whereby it's actually this color is white, instead of being black, it's white, it means that the lens is cloudy. The lens is cloudy. That is cataract. Okay, so cataract is a cloudy, or we call it opacification in a big word, but it means the eye being cloudy. The clear lens is cloudy. Okay, so it's not this growth, because I have seen where patients will come in and tell me, because they have pterygium, they will tell me, my neighbor looked at my eye and said I have cataract. Unless somebody really looks at your eye, like really looks at your eye, they will be able to tell that you have cataract. Okay, all right, so that is it. So cataract is actually it develops gradually. Somebody can begin to have this cataract, but it will not really show on the lens here until after like 10 years. It's a gradual, it doesn't just happen. It's a gradual process. There was a patient I had, a young girl. She was in SS2. yeah, SS2, and she and a classmate, they were fighting or something, and the classmate hit her eye. You know, so by the time she came to me, that was 2015, 2016. You know, though we began treatment on time, I was working with an ophthalmologist, so we managed the eye very well. I told her that you have to prepare your mind. She was 15 years then. I told her that before you're 30, you have to do cataract surgery, because I know that the eye will, you know, become opacified over time. And last year she did cataract surgery and her vision is far better. So I'll get to why that happened. So you have, it's actually gradual. So some people can start experiencing it from 40 years, but it doesn't get to actually will I use the word mature until like 50, 60 years. All right. So basically, when people that have cataract, you ask them how is their vision, the first thing they will tell you is that the vision is like cloudy, it's like harmattan vision, it's dusty. That's the number one complaint that people that have cataracts you know, have, that the vision is harmattan, everywhere is hazy. So these are the common words you hear: hazy, harmattan, cloudy, dusty, because the lens that's supposed to be clear, that's supposed to allow them see you clearly, is cloudy. So everything that comes in through there is cloudy. Then they also experience blurred vision. The vision is not so clear. Some of them experience double vision, you know, and all that. So there are different ways. Then most of them experience night blindness. They don't see well at night. They don't see well at night. So it's very important. So these are the common symptoms of cataract. So how do you now prevent this? Okay, before talking about prevention, let's talk about risk factors. Okay, risk factors is weight. If you're overweight, you're going to have this cataract early. If you are exposed to smoke, it's really, that one is a no-no. Exposed to smoke will increase the chances of having cataract. Family history: if someone in family already had once had cataract and all that, chances are high that you have cataract. Exposure to sun rays, harmful UV rays from the sun can actually increase your chances of having cataract. If you're diabetic, if you're always smoking, if you're always taking alcohol, all these can increase your chances of having cataract. So how do you prevent it? Now, this cataract is a natural change in the lens, right, of the lens. So if your family history, if your family if it's in your family history, you can't really do much to prevent it. But what you can do is to delay the progression of this cataract, right? Basically, that's the most you can do, but you can't really prevent it because it's a natural change in the lens. All right. So basically, what you need to do is change your diet. You can't change your family. Well, spiritually, we believe we can change our DNA, right? So fine, but medically you can't change your family. So if it runs in the family, then yeah, you're gonna have it. Okay, but you can delay it by changing your diet. Increase your intake of leafy green vegetables. So if you have parents, you know, somebody came to my clinic the other day and was telling me that why is it that nowadays many people are having eye problems, cataract, glaucoma, this and that, but back then in the olden days, our great grandfathers, they did not have cataract and all that. Well, I told him, number one, I wasn't there to know if they had cataracts or not, but you can't compare them and us now, because back then when they eat green vegetables, they actually eat the vegetables. Actually, there is a vegetable that my people call green, like we used to eat yam and all that, and rice. We call it green. And these vegetables, you are sure that what they use to grow them is manure, like organic manure, chicken poop and all that. But nowadays, most of the vegetable beds you see, they pack fertilizer and put inside. So you can't really compare the nutrients you're getting from the vegetables you eat now from what our fathers got. You can't. So when they actually eat the vegetable, they get the antioxidants that is in it. They get the real deal. But now we don't. We're not getting the real deal, right? And even when you get small of the real deal, you pack up with shawarma and pizza, and that's kind of nullifies everything. Okay, so basically, change your diet. Green vegetables, take more of green vegetables. Edikaiko, which is Ogo for the Igbos, my Igbo brothers and sisters. Ogo, water leaf, all those green, the greener the better. All right, and then if you are above 40 years, 45, 50 years, you can do supplements. I personally don't like prescribing supplements to young people because I feel that your liver, organs, everything is working optimum, right? So what's the point stressing them out when you can get these things natural? So I prefer prescribing supplements for those that actually need to supplement something. So if you are young, you're less than 40, please get watermelon, get oranges. Vitamin C is very, oranges vitamin C. Get watermelon, get pawpaw. If you cannot chew, blend it. But make sure that in a day you have a good serving of fruit and vegetable in whatever meal you're having. All right, that is how you can actually delay this cataract. But in terms of preventing it entirely, as long as it runs in your family and you fall within any of the risk factors I mentioned, you're gonna have it. So Chidima, I hope that is clear on how you can delay that, right? Okay, so early signs, because Chidima is asking on Instagram, early signs is cloudy vision. Basically, that's the first thing people complain about. Vision is becoming hazy, becoming cloudy. All right, so how then do we diagnose that somebody has cataract? Because people that also have high sugar experience hazy vision. Okay, so it's only when you come to the clinic that the doctor can now do an examination, to find out if you have cataract or not. And it's when they now diagnose that you have cataracts, they can now tell you, okay, this is the stage. Now, there is this misconception, please, 1 second. There is this misconception that you should not do surgery unless it is ripe. Let me explain that, because sometimes I tell my patients the same thing, but I need to explain why we say that. Fact is, you can do cataract surgery anytime. Once you notice that the vision is becoming hazy, you can go and remove the cataract lens, and it's a very simple process. They remove the cloudy lens, put a clear lens. Is done less than 10 minutes. You're done. Why do we tell patients to wait until it's mature? Because we look at the country we are in, our wonderful country called Nigeria, right? Awesome. Now we look at this. If you have a vision, let's say due to cataract, you only lost about 20% of your vision. That means you have 80%, right? You can move around, you can still move around freely, nothing is happening and all that, just that the vision is not as clear. And you decide to go for surgery, right? And then there is complication, which this is our country, anything can go wrong, right? And there's complication, and then you end up losing the entire 100% of your vision. It will be terrible. It will be terrible, especially if you are going to anyhow doctor. It will be terrible. But if you are going to doctors that their success rate is almost 100%, and you know that no matter what, that these people are 100% good, even if at the slightest onset of cataract, you can remove it. But because we look at the possibility of complications which can lead to blindness, we now advise that wait until the vision is totally gone, like the cataract is pure white, like you have 0.00 vision remaining, then go and do the extraction. So that if in that case peradventure there is complication and vision is lost. I hope that's clear. So you don't have to wait until your vision is, until it's ripe, quote and unquote, like we say. No, you don't. We have laser surgeries now. You can do laser surgery, and that one is almost, the chances of complication on that one is minimal. So you can do laser surgery. You can do, which is my own recommendation, if you have someone that is contemplating doing cataract surgery, please, they should go for laser, because laser, they're not doing any cutting, it just goes in and out, right, and it's done. If you have someone contemplating that, that is my recommendation, laser surgery. If you can't do laser surgery and you have to go the normal way, it has to be with a doctor that you can at least vouch for, and that's possible, but you just have to be sure. All right, so you don't have to wait until the cataract is mature. Okay, so I hope that is, I think I've covered it all, because I just asked myself some questions. I've covered it all. Any question? Okay. Oh, thank you so much. Cosmos, thank you. Chidima from Instagram, any question? Okay, you said it's clear. Thank you. All right, so a couple of days ago, let's get to our giveaway. A couple of days ago, let me get the name again. All right, I asked a question on my birthday. That was on Thursday, and I asked, what is a 2020 bureau? Because I know I've talked about it a lot. And then I said that the winner will go home with a digital glass kit. Okay, so this is the liquid cleaner. Ouch. All right, actually customized. Is my company's own, because we now realize that most of the liquid cleaners in the market, kind of, if you are using a blue cut lens, it doesn't it kind of spoils the blue cut, right? So we have to get specially made liquid cleaner. So that's what's inside here. And then this is a Gucci frame, right? So, and then we have the frame here. Okay, so this is a Gucci frame. Is actually, yeah, so look at that. So let me try and put this on. Okay, the lens is not yet in there because I needed to see who the winner is, and I will talk with the winner, then we'll now put the lens. But it's going to have a blue cut and a photochromic lens, in it by tomorrow. All right, and so the winner is Obinna Collins. Yes, Obinna Collins, congratulations on being the winner of our very first giveaway on Eyecare Online on Facebook. All right, so thank you so much, because Obinna is the first person to get the right answer. He said that the 2020 B rule stands for every 20 minutes you spend on your system, look at least 20 feet away for 20 seconds and blink. The blinking part is very important. Some of us got the answer, but we did not put blink. And of course, he was the first to get the correct answer. So congratulations to you, Obinna Collins. And please send me a DM tonight or tomorrow. Let's discuss about where you are, so that we can actually bill, because tomorrow we are going to put in the blue cut photochromic glasses in there, lens in the frame, and then we are going to send this package as it is to you. All right, so you send me a DM tomorrow, so that I can discuss that with my office manager. Yeah, congratulations, Obinna. Thank you so much. All right, so thank you to everyone that tuned in. If you still have questions, don't hesitate to drop your questions. And like I said, please, if you're on Facebook, some of these things I actually do short videos, right, on some of the questions that you guys ask, because explaining it is not the same as saying it. So follow me on Instagram. I'll ask Dr. Doris on Instagram, where you see some of my videos, or on TikTok, the same Ask Dr. Doris, right? So you can see the videos and all that. Then for the long caption, if you're on Instagram, follow me on Facebook at Dr. Doris-Optometrist, because Facebook is easier for me to write long caption and all that, but Instagram and TikTok is good for short videos. So just have to balance all the social media platforms. Okay, so we've come to the end of episode 12 of Eyecare Online. Thank you so much to everyone that's tuned in. I hope you got value. So next week, Monday, we'll discuss something else, and then we keep learning. Remember, the purpose of this is to create awareness, right? So after all this, after listening and hearing and learning all this, if you don't share this information with your neighbors, with your friends, church members and all that, and if you yourself don't go to have your eye examined, purpose is defeated. Okay, so the idea is for you to actually have this information, share this information, let people get help where they need to get help, so that we can at least save one sight a day. That is the purpose. My name is Dr. Doris-Optometrist, and yes, I am based here in Akwa Ibom State. So if you have any eye problem in Akwa Ibom, please send me a message. And if you are in any other part of the country, not the world, the country, I have wonderful colleagues who I can vouch for in different parts of the country. So reach out to me, let me know your location, and let me know how I can help you, connect you to them for your eye care services. Thank you so much for tuning in. Instagram, let me say goodbye to you guys. So thank you so much. Thank you so much. I'm trying to figure this out. Okay, and the video, and what am I supposed to do? Okay, share. Okay, I'll get back to that. So Facebook, thank you guys. Good night.